This is a knee right here. This is a model simulating the knee mechanics and the normal range of motion of our knee. So when people have problems with their knees, it sometimes can be related to the little shock absorbers or the meniscus that's available inside the knee, which is the little cushion or shock absorber. What we're going to be talking about is when the smooth articular cartilage of the knee wears out. And when that happens, that's called arthritis. So not a meniscus problem as much as an arthritis problem, or the wearing out of the tires of the joint. So as people are malaligned, or their knees can have more of a bow, this can tend to wear out on the inside. If people have a knock knee, it can wear out on the outside. Typically, if we have a situation with arthritis, it's either one of the three compartments of the knee joint. If two of the compartments of the knee joint are worn out, then it's going to require a total knee replacement. But what I wanted to specifically talk about is if just a portion of the knee is worn out, such as the inside of the knee, then a person would be a candidate for a partial knee replacement. And as you can see on this metal and plastic, this partial knee replacement really only corrects that one segment of the joint that's affected. So we will put in a metal and metal piece with a plastic spacer in between, keeping the rest of the anatomy, which is normal, i.e. the kneecap, as well as the other lateral side of the knee. So as long as the one portion's worn out, we can do a partial knee replacement through a small incision, minimally invasive. People can go home the following day after surgery. It's done where you're asleep, but we'll put local anesthesia in, and people can recover very nicely with this. And also, because it's such a minimally invasive operation, it does not remove any of the ligaments, and people can have a more normal and increased activity style just because of that partial knee replacement. The x-ray showing just a partial knee replacement. We have normal anatomy here, normal anatomy behind the kneecap. We realign the knee, and this is when the deformities are not bad, and probably people that we see in the office, 10% to 15% are eligible for a partial knee replacement, because we need to be critical and careful to make sure there's not arthritis in other places of the joint. So we really want to make sure our results are good by just not overstepping the boundaries of this. And in my practice, I see a lot of knees, so there are probably more people needing a partial knee replacement or who are eligible for this than a total joint replacement. But the patients do better, they like that better, versus a total knee replacement, where a total knee replacement really replaces the whole surface of the joint. So all three compartments are replaced. The plastic button and plastic articulating spacer between the two metal portions of the knee allow for range of motion of that knee. And this replaces the arthritic joint. And we can take more severe deformities and correct them. We can take people that have arthritis in 2 or 3 places where the whole joint is destroyed, and being able to replace that with a total knee replacement. So the results of these knee replacements approach 98% success rate in terms of pain relief. These can click a little bit because of the plastic and metal surfaces here, but yet the patients feel very, very good because we've eliminated the arthritis. So a skilled knee operation, patients are typically in the hospital 2 days to possibly 3 days. We glue these in, and so they're immediately stable to be able to put all the weight on there as soon as possible. We get patients up the same day of surgery and allow them to weight bear. So typically 2 days to 3 days in the hospital for a total, typically overnight for a partial knee replacement. Partial knee replacements are typically for the younger patients and more active patients, where perhaps we want to gain 10 years or 20 years, that if they've had a meniscus removed when they're young or they have isolated arthritis, this can buy time. So it's similar to a dentist where you would do a partial rather than a full denture replacement. So a partial knee replacement can really help people stay active, and in the event this wears out, we can always convert it later to a total knee replacement. Orthopedic surgeons of the past used to remove the total meniscus. When people had an anterior cruciate ligament injury, it oftentimes was combined with a meniscus injury. So when anterior cruciate ligament reconstruction was done, a lot of times the meniscus would be removed. Patients would then wind up having a deficit and no cushion in there. The shock absorber is gone. Therefore, people that had this done when they were young are now wearing their knees out where the meniscus was in their 30s and 40s and 50s. So we know that 15 to 20 years after having that meniscus out, we see a lot of patients that have bad arthritis because the shock absorber has been removed, or the ACL is torn, leading to more movement. So for patients that have a previous removal of their meniscus in the old days, they can develop arthritis prematurely. And so those patients are good candidates for a partial knee replacement. Currently, we use arthroscopy, which does minimally removal of the meniscus, so we try and repair and keep meniscus tears. So it's becoming less of an issue as technology evolves, but there are a lot of people in their 40s and 50s that have a worn out knee because of an old trauma when they were in high school or some sport activity, and therefore they're left with some debilitating arthritis in the inside of the knee. The patients are left with a disability because of removal of the meniscus to account for that arthritis that they have or they're suffering of now. So that partial knee replacement can work well in young individuals to try and get them into their 60s and 70s and 80s when we would do a knee replacement, which is a little bit less demand for a knee replacement. We don't want people to be jogging with our knee replacements, but yet they can still be very active with this partial knee replacement and usually resume their sports or activities they want to do, because of course they're usually in their 40s, 50s, or 60s.